Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about study finds that delaying antibiotics for neutropenic fever may not affect survival of cancer in patients. In cancer patients with neutropenic fever, delaying antibiotic treatment past 60 minutes from the time of fever detection does not reduce the short-term chance of survival, according to a study in the American Journal of Medical Quality. Neutropenia occurs because chemotherapy destroys neutrophils along with tumor cells. A fever in a patient with neutropenia is considered a medical emergency, according to study authors. The fever signals a severe decrease in neutrophils and therefore a compromised ability of the immune system to ward off infections. Neutropenic fever is defined as a temperature of at least 101 degrees or a sustained temperature of at least 100.4 degrees for an hour or more. The Infectious Diseases Society of America and the American Society of Clinical Oncology have both published guidelines for treating outpatients who have neutropenic fever. Both organizations call for administering an intravenous antibiotic within 60 minutes after the fever is detected. The recommendation about antibiotics is also often applied to the treatment of hospital inpatients, but there's no clear evidence that's appropriate. Only 14% of patients received antibiotics within 60 minutes of developing neutropenic fever. Their survival rate 6 months later wasn't significantly better than the survival rate of patients who received antibiotics later than recommended. Further analysis identified several factors that had a statistically significant association with the risk, which are as follows. Patients with insurance had a 72% lower risk of death than those without. Patients with at least one other major medical condition had a 2.7 times greater risk of death than those with blood cancer alone. Patients who were treated with antibiotics within 40 minutes actually had a 5.7 greater risk of death than those who didn't receive antibiotics so quickly. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.